My name's Louise Litchfield. I work for the Darling Downs and West Moreton Primary Health Network, PHN. I'm the Director of Stakeholder Engagement. Okay, well, we were fortunate enough to become highly commended for the Talk About campaign that we run at Darling Downs West Moreton PHN. This is an ongoing campaign, it's not a one-off. We do it several times a year and it helps inform our health needs assessment. And we've been really innovative in the way that we've gone out to get the opinions of people around their health. What we know about health is that they get significantly improved health outcomes if people have a say in the way we design their health programs. So we cover a whole range of topics. This year alone we've done alcohol and other drugs, we've done digital health, we've just done an amazing engagement around young people and their health, which included interviewing people from the Brisbane Youth Detention Centre and young Aboriginal and Torres Strait Islander people in Cherbourg. So we're getting a really wide range of views. The main thing for us is being authentic and genuine. We feed back to people the information that we've heard and we let them know how it's going to be used. We have a range of tools that we use. So there's a community-wide survey that anyone can access. There's versions of that for the general community as well as our healthcare professionals. And that gives us a baseline of what people are thinking about the system and where we can improve and their experience of the system. And then we supplement that with some kitchen table discussions. We partner with Health Consumers Queensland to run those. And they're really detailed conversations around that particular health topic, and we run them right across our region. I'd like to say we had some surprises, but really, unfortunately, we didn't. You know, a lot of the groups that we have, particularly young people, it won't surprise anyone to know mental health is their biggest concern. I guess the second biggest concern was vaping, so that's probably a new one for us. The sad thing is, you know, is that across the system, people want to be respected, and young LGBTIQ people in particular struggle in some of our regional areas to get the care that they need and the respect that they need. So we're always listening. We're always really take on this program with a really open mind. We can't assume anything about people's care. We had a comparable program happening up in Kingaroy where we worked with about 50 13, 14-year-olds around their mental health care. All the things that adults think kids want, they don't. You know, we think they want complex care, they don't. They just want connections and friends, and we're really learning that about mental health, that people need, they're lonely, or they need connectivity, or they need something else to do, some way to feel valued, and throwing more money at more complex systems is not helping them. We started this program as part of our health needs assessment. So primary health networks have to do a revised health needs assessment for the region every 3 years. And this was a way for us to get a rolling input into that health assessment. So we weren't waiting for 3 years to ask people again. So internally, right across all of our parts, everyone's got a role. And if the topic covers, you know, their particular area, they sit on the steering committee for that topic so that we make sure they're getting the information that they need. When we hear from people about the actual process of talking to us has helped them, that's really rewarding. I think my favourite is that when we did the work with the kids at the Brisbane Youth Detention Centre, a former resident of the detention centre actually facilitated that group, and he was really nervous about it, but he felt really empowered at the end of that conversation, and just by running the process we'd helped him. Really making sure that people see the value, that they see their input being put to work, that we're increasing the participation. And we found this year, you know, we've been doing this for nearly 3 or 4 years now. This year we've really started to up that engagement and getting younger people involved. You know, older people's opinions are really valuable, particularly when it's about older people's care. We can't, you know, and dementia and a whole range of other things, but often older people have got the time to do that, and that's not always the voice that we need to hear. So the challenge has been really branching out and getting younger people and a more diverse voice, but I think we've got there. It's a reflection of the planning that you've done for your own program. So the better the program was planned, the easier your reward submission is. I guess I had come from the benefit of being a judge as well. The evaluation, we know evaluation is really hard in this program. To get funding for evaluation is not always easy, but it really adds to your submission. So if you can provide some input into, did it work? We're quite good at looking at what we did and how we thought about it, and what, who turned up and all those kind of numbers, how many likes we got and how many clicks. But that really genuine evaluation, did our program work, is a huge value for your application.